95,000 Americans are now hospitalized with COVID-19. Nearly 205 million doses of Pfizer's vaccine have gone to Americans so far. And the hope this morning that this full FDA approval could convince even more to get that shot. Eva Pilgrim joins us from right outside Pfizer's headquarters here in New York with the very latest. Good morning, Eva.
Good morning, Cecilia. This is one of the most studied vaccines in history. On top of the more than 40,000 volunteers in the clinical trials, we now have 8 months worth of real-world data from the more than 1.2 billion doses that were given out around the world. And health officials are hoping that will reassure those who are waiting to get that first shot. This morning, major new developments in the fight against COVID-19. The FDA granting full approval for Pfizer's vaccine, the fastest vaccine approval in FDA history.
Those who've been waiting for full approval should go get your shot now.
Pfizer becoming the first vaccine to move past emergency use authorization. Their shot, made with mRNA, does not contain any part of the coronavirus and does not alter people's DNA. In order to get full FDA approval, Pfizer had to undergo a more stringent review, submitting results from its ongoing clinical trials and proving substantial evidence of effectiveness.
The FDA not just took their time and did the due diligence that needed to be done, but did it quickly and efficiently.
The move paves the way for more corporations, government, and schools to issue vaccine mandates. The Pentagon now preparing to require the shot for its 1.3 million active duty troops. New York City announcing shots will now be required for all school employees, with weekly testing no longer an option. And workers at United Airlines have 5 weeks to show the now required proof of vaccination. While the FDA's full approval of the Pfizer vaccine applies to those 16 and older, the agency making it clear that does not mean it should be given off-label to younger children.
They are not just small adults, so we really would have to have the data and the appropriate dose before recommending that children be vaccinated.
But this first full approval could be a game changer for those who have been hesitant to get a shot. A recent poll finding that 3 in 10 of those unvaccinated would be more likely to get it now. And with every state in the country now experiencing high community transmission except Vermont and Maine, more Americans are dying of COVID. Now, an average of 738 every day. Florida just saw its deadliest week. Healthcare workers hoping people will get the vaccine as they face a crush of COVID patients.
One of my biggest frustrations is that we're maybe not vaccinating our kids at a rate that is beneficial to everyone.
So what about the other vaccines? Full approval for Moderna and Johnson & Johnson is expected in the coming months. George?
Okay, Eva, thanks very much. Let's bring in Dr. Francis Collins, Director of the National Institutes of Health. Dr. Collins, thanks for joining us again this morning. We all saw that poll showing that 30% of the unvaccinated are likely to get vaccinated because of this full approval. But other experts I've read say that the impact is likely to be vanishingly small on those who are still holding out. What's your view?
Well, we're going to test that question, aren't we? And let's celebrate a moment, a little bright sunshine here coming through the COVID clouds. I think this is a big deal, getting this full approval. And I hope of those 3 out of 10 that have said this was a significant factor in their holding off, that they will see today as an opportunity to change that view, hit the reset button on all those other reasons that they had heard why this is not a good idea, and decide to roll up their sleeves, because Delta is out there looking for you. If you're unvaccinated, you're at serious risk of this very contagious variant.
The more significant impact could be because this clears the way for more vaccine mandates. Where should vaccines be mandated? Where shouldn't they be mandated?
Well, that's going to be very much up to businesses and universities. And of course, the military has now come out to say active duty troops will need to be vaccinated. I think that's a great idea. We know this vaccine is safe and effective. We want to keep people safe and not let them get sick. You've seen already, just in the last 24 hours, since this approval by FDA, universities in Minnesota and Louisiana coming out saying, okay, that does it. We were waiting for that. Now we're going to mandate that for our students. So yeah, there's going to be encouragements, and then there's going to be something a little more significant here in terms of requirements, but it's the right time. Come on, America. We still have 85 million people who haven't gotten that first jab, and they are at risk, and they're putting the whole country at risk. It's time to turn that corner.
How about vaccinations in kids? What do these trials tell us about that?
Well, basically, the approval now is for kids 16 and on into adulthood. And 12 to 15-year-olds still can get vaccinated and should be with emergency use. In terms of kids under 12, Pfizer is not yet submitted their data to the FDA on 5 to 11-year-olds. That's expected maybe by late September. Keep in mind, kids are not just scaled down adults. They have different immune systems and metabolism. You really have to do the careful trials to make sure you got the dose right and there aren't any surprises. Realistically, George, I don't think we're going to see approval for kids under 12 until late in 2021.
That could be some time. Where do you think we are overall on the surge right now? There have been some suggestions that we could be reaching the peak of the Delta variant surge.
Well, I would love to think that's true, but when I look at the data, it's still going up awfully steeply. More than 150,000 cases a day, and that number keeps growing. Hospitalizations, 95,000. Deaths now averaging 1,000 a day. Yeah, maybe you could kind of peek at that curve and say maybe it's trying to find its way from this steepest slope into something a little bit more gradual, but boy, no reason to be too confident of that. I do see in some states like California seems to be having a better time than they were a couple weeks ago, but gosh, Florida, Louisiana, Mississippi, Alabama, there's just a world of hurt going on there with so many unvaccinated people and hospitals really struggling to try to manage all the really sick people who are coming to their emergency rooms.
And what's your best recommendations on boosters right now?
Well, let's see what FDA and CDC make of the data on that. You heard last week, and I was part of the group of doctors that looked hard at this data, that we do think boosters are going to be beneficial starting about the week of September 20th. But I don't want to jump ahead of what FDA and CDC may say over the course of the next month. But I think we can probably expect that to be the case in order to keep this protection, especially in the face of Delta, just at the highest level possible.
Dr. Collins, thanks for your time and information this morning. TJ?
All right, George, we're going to turn now to the crisis in